Hello everyone, I have a wonderful lady. She is post-op day number 4 from her textured breast implants. These were 480 cc's, a lot of inflammation. We did the Facebook Live 4 days ago. Now let me ask you this. How did you find me?
Well, I did a lot of research. I started having all of these symptoms that I could not explain, that over 12 different specialists could not explain. They ended up putting me on antidepressants, anti-anxiety, antipsychotic medications, thinking that I was just making all these things up. And one day I came across BII and all the symptoms that it presents. And so I started doing research. And I found Dr. 𝐾𝐿 online. And what really impressed me was that he doesn't put implants in, he only takes them out. And the way he talks to his patients, the way he cares about his patients, his empathy, his compassion, all of his knowledge, the research that he has done, that he has presented.
No, thank you very much. Now, what were the 12 specialists that you saw?
Oh, everything from neurologist to rheumatologist, endocrinologist, just so
and they
many.
all said you have a clean bill of health.
Yes, that was fine. Or that I had something, they would diagnose me with something like fibromyalgia, Hashimoto's, but then it would evolve into something else, PCOS. So I had all of these diagnoses, and I was on all these medications that just made me feel even worse.
Right. Now, one thing unique about you, or interesting that a small group of people do, is you actually flew out from Florida just for the consultation. And
Yes.
You just wanted to see me, the facility. And I remember you specifically flew out, and I admire that because you want to, you obviously, there are 2 patients that I have to talk to today that bought their day without even talking to me. Yes. You are the opposite, where
Right.
I want to see you. You remind me of that nice lady that lives in Africa, and she flew out just to see me for the consult. She had the time and the money, and and her insight and her personality, where you want to be like hands-on, right?
Right.
And so that is you did your homework. Now, how many? And you don't have to mention any names. This is pure professionalism. How many different plastic surgeons did you seek out? Because you came from Florida.
Yes, I came from Florida. 2 plastic surgeons I spoke to, and then I did a research on a few more, but they just, well, I guess one of them kind of mocked BII, didn't really believe me, and kind of made it like, sure, I'll take him out, in and out kind of surgery. The other surgeons were still implanting. So I just didn't feel like the explanting would be sincere and whole and meticulous like you.
Sure, no, thank you. I remember it's all about that meticulousness, that complete sincerity, that all of the badness is removed, that if the surgeon were to go back, he could not or she could not remove anymore. Now, let me ask you this, 4 days out. So you had the twilight anesthesia. You heard yourself literally sleep through the surgery.
Yes.
You have no recollection of the surgery like any of my patients. Now, let me ask you this. What and how did you notice post-op, like as far as any improvements, if at all?
Oh, incredible. Actually, right when I woke up from surgery, my mother noticed that my complexion was different, that my eyes were brighter, that I was speaking more clearly, I could think more clearly.
This is right after?
This was immediately after. She just looked at me and said, oh my gosh, I can see the difference in you already. And I have had chronic neck pain, neck and shoulder pain, that I have been getting deep tissue massages weekly because it is so debilitating. And that is completely gone. I can't even believe it as I speak right now. I have no neck pain, which is just outrageous. I've had that for years and years and years. So.
Now, you got the Exparel. Now, let us know what pain medication. You did not take any Norco.
No.
And you took basically how many Tramadols?
Just one.
Just one Tramadol.
I've just taken one pain pill.
Yeah, and then you took Tylenol once for the headache that you had. Yeah, and this is if you ask me, the magic of the Exparel, and it works. If you ask me, I wish every surgery in the world that was being done, every patient, be it a carpal tunnel, be it tummy tuck, be it like a thyroid, they should get the Exparel, so no one has to take any narcotics, because that would literally eliminate millions of narcotics that are unnecessarily used, because remember, all pain meds are bad. And overall Exparel has a very good safety profile, and every children's hospital should be using it, so no child should have to go through pain, and even any adults, for example.
Yes.
Now, let me ask you this. What we need to do is we need to follow up with you in the next 6 weeks, 8 weeks, and follow up to see where you are. Now, the moment I walked in and I saw the white of your eyes and your face, definitely it was a before and after. And I've seen you a few times now, but this is basically very dramatic. And I said, you know what? And believe it or not, when I was doing your surgery, the textured nature of the implants, the inflammation that was present was much more than the other lady where they have the smoother implants, be it saline or silicone. And not surprised to see that how well you have recovered. Now you're heading back home. We'll continue to follow your progress. Thanks for sharing your journey. Anything you want to say to anyone who's listening?
Yes. If you're thinking about getting implants, please do not do that to yourself. BII is real. And if you have them in, please, please, please come see Dr. Khan, because he is a true advocate for us, and he believes us, and he will give you the peace of mind that everything is completely gone and out of our body, so we can continue to heal.